Good morning. Thank you, everyone, for joining us to celebrate our ongoing work to remove childcare barriers to employment for all Michigan families through the My TriShare Childcare program. This vital work is off to a great start, and we continue to move toward establishing TriShare in all 83 counties in the state as part of our bipartisan efforts to help everyone on a path to an equal opportunity. I'm pleased to be joined by Michigan Women's Commission CEO Cheryl Bergman and State Representative Greg Van Workum of Norton Shores. I'm also excited to welcome Nate Henschel, Government Affairs Director for the Grand Rapids Area Chamber of Commerce, along with some of our TriShare partners from across the state. Denise Smith, Implementation Director from Hope Starts Here, our Detroit Hub facilitator, Diane Peacock, Human Resources Manager for Wolverine Coil Spring, our TriShare business partner based in Grand Rapids, and Wolverine Coil Spring employee and TriShare parent, Melissa Trotter. We're here today because we know that one of the biggest barriers for people seeking to remain in or rejoin the workforce is the cost of childcare, resulting in more and more parents being left behind as Michigan's economy grows. We appreciate Governor Whitmer's leadership in working with the lawmakers like Representative Van Workum to address the child care crisis faced by working families, employers, and communities across our state. We were able to launch TriShare as a result of work by a coalition of business leaders and other stakeholders led by the Grand Rapids Area Chamber of Commerce and elected leaders like Representative Van Workum and others. We want Michigan families to know that we've got their back, and through programs like TriShare, they can afford to stay on the job and care for their family. Through TriShare, the cost of childcare is shared equally by an eligible employee, their employer, and the state of Michigan, with coordination being provided regionally by a facilitator hub. The program helps to partner private and public organizations to increase access to high-quality, affordable childcare for working families. Together, we identified a problem and worked as a team to find a solution. Taking an innovative and out-of-the-box approach to the way we address the challenge of childcare for employers and employees, we found an answer that is getting results in leaps and bounds. After starting as a pilot program in early 2021 with 3 facilitator hubs, TriShare has caught on like wildfire. TriShare has expanded to 59 counties and the city of Detroit in record time. And in the last 9 months, enrollment numbers have jumped from 27 to 96 employers, from 17 to 102 employees, and from 19 to 130 children. During the same period, the number of facilitator hubs grew from 3 to 13 statewide. And facilitator hubs are busy recruiting more employers in their region every day as the word spreads. We also know that job seekers are actually looking for employers who participate in TriShare when deciding where they want to work. In fact, hub facilitators report that job seekers in large numbers are contacting them to find employers who are participating in the program as they look for the right fit. Businesses enrolled in TriShare range from small employers engaged in various services to large-scale manufacturing operations. They include workers in the public and private sectors, from agriculture and manufacturing to nonprofits and social service organizations. More and more employees are taking advantage of the TriShare program every day because they recognize how much they can save in childcare costs. Studies have shown that the high cost of childcare often stands as a significant barrier to parents who want to stay on the job after the birth of a child, but can't make the math work when faced with the significant dent childcare puts in their family budget. The Center for American Progress estimates 101,713 Michigan parents made career sacrifices in 2021 due to issues with childcare. That's up significantly from 76,666 parents in 2019. That's not only bad for working families, but it's also bad for business, and it's bad for Michigan. That's why TriShare is so critical from an economic standpoint. Employers and economic development experts are all too aware that childcare stands as a barrier to employment, and they are taking notice that participating in TriShare offers a way to invest in their workers, retain their quality workers, and increase their talent pool. They also know sharing in the cost of childcare is a powerful recruitment tool, especially in a market where employers are tripping over themselves to attract job seekers. Michigan has a great business climate, and with TriShare, it gets even better. TriShare has officially moved from the pilot stage to a fully funded, ongoing project thanks to Governor Whitmer and Representative Van Workum. Democrats and Republicans in the legislature have seen its value and supported its expansion by funding it in the state budget because they saw that it works. It continues to succeed and grow with bipartisan support. But Governor Whitmer and our team won't stop until it is available in every Michigan county. We're confident the legislature will work with us to ensure it is ultimately available in all 83 counties. TriShare stands as a shining illustration of what can be accomplished when the public and private sectors work together to find a solution that benefits everyone. If we all can agree that no Michigan parent should have to choose between caring for their children and staying employed in a job their family needs to put food on the table, we can move the ball down the field. Our state's economic vibrancy depends on removing barriers to employment so that every person who wants to work can afford to work, and every employer who needs current and future employees to grow their business has a talent pool to draw from. Parents tell us that childcare often is so expensive and difficult to find that it doesn't make good financial sense for both parents to work. Michigan employers tell us they often can't find enough quality workers to fill critical jobs, in part because of barriers like the high cost of childcare. And we recognize that Michigan's economic vibrancy depends on our workers staying on the job and overcoming barriers to employment like childcare affordability and accessibility. That's why we created TriShare, an innovative program to address the childcare affordability and access challenge faced by too many working families. The TriShare public-private partnership that equally shares the cost of childcare among employers, employees, and the state of Michigan is good for everyone. With my TriShare, parents can get back to work knowing that their kids are safe, cared for, and have the opportunity to succeed. And employers can get and keep the workers they need for their businesses to grow and thrive. We all win when we work together. Thank you. And now I'd like to introduce Cheryl Bergman, CEO of the Michigan's Women's Commission, to talk about the importance of TriShare for women and families.
Thank you, Director Corbin. My name is Cheryl Bergman. I'm CEO of the Michigan Women's Commission. In late 2019 and early 2020, the Women's Commission traveled the state asking women what their priorities are. And everywhere we went, from Flint to Traverse City, Detroit to Grand Rapids, they all cited economic security issues with affordable, accessible childcare at the top of the list wherever we went. And this was before the pandemic hit. There was nothing good about the pandemic, but it did illuminate the issue of childcare and its importance to our economy. Now our policymakers and employers are talking about childcare as an economic driver and not just a family decision. 159,000 women have left the workforce entirely in Michigan since February 2020. The Michigan Women's Commission is committed to removing barriers to work for women who want to join the workforce. We need culture change when it comes to caregiving and its value. But until then, good policy like TriShare is a great start. The TriShare program serves the ALICE population, or Asset Limited Income Constrained Employed. These are the families who make too much to qualify for child care subsidy, but still struggle to afford child care. To be eligible for TriShare, the employee must have an income between 250% and 325% of the federal poverty line. That's about 90,000 for a family of four. A recent study by the Economic Policy Institute estimated the average cost of infant care in Michigan at nearly $11,000 annually, or about $900 a month. That's just shy of the annual cost of in state tuition at a 4-year public university. Now consider that TriShare divides that cost three ways. That's a savings for working parents of $6,000 to $7,000 per year, depending on the age of the children in childcare. That extra $500 or $600 a month could pay for a car payment or breathing room for a rainy day. TriShare is changing lives. Yesterday in Battle Creek at the Michigan Women's Commission public meeting, we heard from Kathleen Moore, who is Executive Director of Battle Creek Shared Services Alliance, who is administering TriShare in Calhoun County. She shared that one mother who has children enrolled in TriShare is thrilled that she was able to stay in a job that she loves while knowing that her children are well cared for while she's working in that job that she loves. I would also like to stress the importance of partnerships between our public and private sectors in expanding TriShare's reach. We are especially grateful for the grant from the W.K. Kellogg Foundation that supports the work of Battle Creek Shared Services Alliance to administer TriShare in Calhoun County and another administered by Mothering Justice in Detroit. The Balmer Group is also funding 2 TriShare hubs in Southeast Michigan. The Women's Commission is happy to work with all of our partners to provide affordable, high-quality childcare for our families. It is now my honor to turn the microphone over to one of those partners and legislative champion of the TriShare initiative, State Representative Greg Van Workum.
Thank you, Cheryl. Thank you also to all my colleagues and everyone that has been a part of putting this TriShare program together. When I first joined the legislature, this was an issue that I certainly cared about. As a dual income family, we had this issue. We had the issue of sitting at the kitchen table, which I'm sitting at right now, and deciding whether both of us were going to work or just one. And we saw that throughout the state. As I went through and met with manufacturers across my district, this was the number one issue of trying to find affordable child care. So it was exciting when I came to the legislature that there was a coalition led by the Grand Rapids Chamber that was in this issue, wanted to come up with a creative solution, knew that employers were willing to step up and be a part of it. And that's how we formulated TriShare. It took some effort, it took some time, but after 2 years and seeing the excitement for the program across the state, it was good to hear those numbers about the amount of families and kids that are now a part of this. That's how I want to see the growth. That's how I want to see the measurement. It's not necessarily the territories, it's how many families and how many employees we can help through this program and move it forward. And that's why I'm part of this press conference today. We want to continue to spread the message of what's happening here in childcare and get businesses excited about this, to come together so that they see this program, can see the benefit of this program for their employers, and hopefully they'll join forces and open new facilitator hubs in their regions. As the director said, and the head of the Women's Commission said, there's still that need out there. There's a lot of need out there. And when we focus on that affordability side, we're going to have that accessibility side, and then we're also going to have the increase in the type of care that we have for those kids. So I'm excited that there's excitement about this program. Look forward to continuing working with the coalition so that we can move it forward. And I appreciate all those coalition members for continuing their advocacy to our members and to the administration so that we can continue to move this program forward. With that, I'd like to introduce Nate Henschel, Director of Government at the Grand Rapids Chamber.
All right. Thank you, Representative Van Workum. Good morning. My name is Nate Henschel, and I have the pleasure of serving as the Director of Government Affairs for the Grand Rapids Chamber. There is no doubt that access to quality, affordable childcare is a business issue. One of the largest barriers to entering the workforce today is the lack of quality, affordable childcare. That's why several years ago, the Grand Rapids Chamber got to work with a broad coalition of partners from around the state to help solve the childcare crisis. Working with a statewide coalition of partners, the legislature and governor's office, TriShare was born. As the first of its kind program in the country, TriShare sought and continues to work to build private-public partnerships to help address access to quality, affordable childcare. We know that when families don't have access to affordable childcare, frankly, we lose out. Successful employers have a long-term vision. It's not hard to see that we must start the process of growing a talented work pool early on. We know that education and development in the 0 to 5 space is critically important for preparing students to enter K through 12 education and vital to a pattern of learning that will sustain and grow the workforce of tomorrow. That process begins with childcare. Childcare is not only an issue facing today's workforce and employers, but one that will be a top concern for the businesses of tomorrow if we don't begin to address it now in a sustainable way. Thank you to Governor Whitmer, Representative Van Workum, and the entire legislature for their tireless support of the TriShare program and for making quality, affordable childcare a reality for more Michigan families. We at the Grand Rapids Chamber look forward to partnering with businesses, families, the state, and providers to ensure TriShare continues to grow and that Michigan families can succeed. Employers looking to recruit and retain top talent, this is a program for you. We need more employers to sign up to offer this truly innovative benefit. We'll hear in a few minutes from an employer and employee on how this was a game changer for them and their organizations. This is an opportunity to not only be a part of the solution, but also for a way for companies to set themselves apart from the competition. Now, let's hear from Diane Peacock, who serves as the Human Resources Manager for Wolverine Coil Spring, one of TriShare's employer partners in Grand Rapids.
Thank you, Nate. I'm Diane Peacock, and I'm with Wolverine. I'm the Human Resources Manager at Wolverine Coil Spring in Grand Rapids. And we heard about the TriShare program early on and decided that was something that we were definitely interested in providing for our employees. We had a situation. The 2 employees came to mind immediately that we could assist with this program. I had one employee who was a primary trainer in her area who was stuck on an off shift because they couldn't find childcare. Couldn't afford childcare, so it was a wonderful way for us to be able to get her back to a shift where she could train others and we could train her. We had another employee who you'll hear from in a few minutes who I know was struggling with the cost of providing childcare for her child. It's a wonderful way to retain our talented employees, and it's a wonderful way for us to recruit new employees. There's been zero downside to this from a business perspective, and I don't see any reason why any employer would not sign on to this program. It's great for us as a business. There's been, like I said, zero downside to this, and I hope this program continues into the future. And now I'd like to introduce Melissa Trotter. Melissa's one of our department leaders here at Wolverine Coil Springs. She's a single mother and is involved in the TriShare program. And it's allowed her to have more affordable access to childcare for her daughter.
Thanks, Diane. Hi, I'm Melissa Trotter. I'm a single mother of my daughter Ava, whom I love very much, and I would give the world to. For the first 2 years of Ava's life, my mother and my grandmother cared for Ava while I worked. But then that was no longer an option, so I had to look into childcare. And, oh, excuse me. Um, I work at Wolverine Coil Spring. I'm a department leader. I love my job. I love the company. And I've been here for about 12 years. And I've been making pretty good living here. But with childcare, I was struggling. It was costing me about $800 a month in childcare, which was almost as much as a mortgage payment. And so I was definitely struggling. And I made too much money to qualify for any of the child care assistance programs, but meanwhile, I just was barely making enough money to take care of my household, put gas in my car, pay for Ava's child care, put food on the table. So I was really struggling. Um, Diane mentioned the TriShare program to me, and it totally took a burden off of me. I am now paying $280 a month in childcare expenses, which has been a total blessing. Um, I'm able to keep working. I'm able to keep Ava in a daycare where she's made plenty of friends, and she's able to develop and grow in that program, which is great. And so that's how TriShare has definitely helped my family. I encourage any working parent, any single mother, single father that is struggling to make ends meet and need help with childcare to talk with their employers and have them look into TriShare. This is definitely a lifesaver. Thank you. I'd now like to introduce Denise Smith, Implementation Director of Hope Starts Now, which is one of TriShare's facilitator hubs in Detroit.
Thank you for that testimony, Melissa. My name is Denise Smith, and I am the Implementation Director of Hope Starts Here, Detroit Early Childhood Partnership. We are facing a childcare crisis in Detroit and throughout Michigan. We have too many children in childcare deserts, with 1 out of every 3 children unable to get the care that they need. That's why we are so pleased to have been designated a facilitator hub in Detroit, the Detroit Collective, that is coordinated by Hope Starts Here and powered by Everybody Ready, that facilitates provider family matches and provider payments. We look forward to working with TriShare as the best available pathway to reduce childcare costs for working families. Our work at Hope Starts Here is to ensure that more children and families from all walks of life have the tools they need to prosper. As a Southeast Michigan facilitator hub, Hope Starts Here serves as the intermediary between employers, families, and childcare providers. As one of 2 hubs in the area, I can tell you that TriShare is working and growing in Detroit. We are so proud to be part of this highly valuable, innovative program for improving childcare affordability for employees and enhancing employers' ability to maintain and grow the workforce. The work we do as a facilitator hub is multifold. We work with employers to get them familiar with the process of becoming a TriShare partner and to answer any questions or address any issues they may have regarding how TriShare works. We also make sure that we're guiding participant or potential participant employees, including helping connect them with reliable childcare facilities. Our central partner, Everybody Ready, has a long history of working with childcare programs and matching parents to quality facilities that meet the needs of parents and child. As a hub co-facilitator, we recognize that affordability isn't the only hurdle for parents. Often finding the right provider is an equally big obstacle. TriShare can help. Make no mistake, we are facing a childcare crisis on many levels. Low wages, limited availability, and lack of staff are crushing the childcare industry. There are childcare deserts out there, but TriShare can be an oasis for parents who need assistance in answering their childcare questions and helping find solutions for them and their employees. Another customer we get at the facilitator hub is a job seeker who wants to know what employers participate in TriShare. We love that question because it means TriShare is working and it is spreading amongst the community. It illustrates that businesses participating in TriShare may have an edge in recruiting workers. We want businesses to know that we are actively recruiting them to take part in TriShare. And we want them to know that job seekers want them to offer TriShare to. Thank you. And now I'll turn it back over to Director Corbin to wrap things up.
Thank you, Denise. Today's event marks the kickoff of a statewide awareness tour to promote TriShare and encourage more businesses and employees to participate in providing some relief to working families trying to make ends meet. More information on TriShare is available at michigan.gov/TriShare. So thank you. And now we will open it up to any questions from our friends in the media.
Great. Thank you, Susan. And to media members, I just want to note, if you have any questions, please put your name and media outlet in the chat, and we will call on you so that you can be unmuted and asked. But our first question is from Rachel Watson with Crane's Detroit Business.
Hi, thanks for taking my question. It's a couple-part question, so I'm hoping that's okay. The first one is I saw a press release from February that said TriShare at the time expanded to 52 counties with a 200 or 2.5 million funding from the general budget. Did that take effect immediately at the time? And if so, what's the news peg here today? Is the program exiting the pilot phase today? Or when did it most recently expand? Rick told me it's now in 59 counties. That's the first part of my question. And then the other question is about funding, which I can ask after you've answered this.
We'll let Cheryl Bergman take a shot at that first question.
Sure. So thanks for the question. So the timeline, the pilot launched in March of 2021, an FY21 budget, and then FY22, it expanded with another 2.5 million, and that's when we expanded from 3 hubs into the 13 that we're currently at, and that included the WK Kellogg Foundation funded hubs and the Balmer Group funded hubs. And then for FY23, there was another 2.5 million allocated for TriShare and made that funding ongoing. So that's kind of the timeline.
So just to follow up, what's the news peg today?
What is the, sorry, what was the question?
What is the new news today? Is it exiting the pilot phase today, or has all of this already happened? And if so, when was the most recent expansion?
October 1st, FY23 is no longer a pilot. It is in the program phase at this point.
Okay, thank you. And then my second question about funding, what were the amounts specifically for childcare listed in the FY23 budget, and specifically for the childcare for the TriShare program? And then what is the total funding amount that's been allocated for TriShare so far from public and private sources, and what are those sources?
Sure. Sure. So another for FY23, 2.5 million was allocated again. And so it is between the public and private foundation dollars. We are at, let me just double check, 5.6 million between the public and private funding since 2021.
Okay. Could I get a list of what those private foundations are after, or in the chat maybe?
Yep, I'll chat. It's just 2 foundations. I'll chat you that now.
All right. Thank you, Rachel. Next up is Daniel James with MERS.
Yes, hi. Thank you for having us. I guess my question is, you're talking about the expansion to all 83 counties. Do you have any timeline or, yeah, so I guess that's my question. What is your timeline for that expansion now that you're out of the pilot phase?
I can tell you that this is Cheryl. I can tell you that the boilerplate, the legislation for FY23, said that we are not to expand further in FY23 to other regions. So we'll be exploring that in for the FY24 budget, expanding to further counties.
Okay, perfect. Thank you.
All right, and the next question we have is from Mark Sanchez with MyBiz.
There you are. Good morning, everybody. Thank you. And Greg, curious if you could just talk a little bit about what really shifted the legislature's mindset to provide funding for this, and what's the general view among the legislators in Lansing? Whether is this just something that, okay, we're going to do this for a few years and then let it run its course, or is there a mood that this is now a permanent initiative that needs regular funding in the budget each year?
Well, Representative Van Workum is the one who is most qualified to talk about that.
Thanks for the question. I think it's a little odd as kind of a male Republican looking at this issue. It's traditionally been something that looked as more of a social program when you're thinking about childcare. But as I said in my comments, a lot of it was employer driven. They saw this as an impediment for economic growth. So there was a lot of interest in coming up with a different approach to this, in that the previous question was asked about how much money was going into specifically this program. But when you look at the total amount that the state government puts into child care, and a lot of that is flow through from the federal government, this is a very small piece. That's why we wanted to work as a pilot to see, okay, can we come up with a different model here in the state of Michigan that will make childcare affordable rather than just using those public funds? And what we saw and what you heard today is employers are interested. They see this as an impediment to growth, and they wanted to participate. And as we had those conversations, it wasn't necessarily the tax breaks or the flexible spending accounts and things that we've tried before. So we came up with this model to come up with a different way to approach it and to see if this could be a model for the state, and then see if we can grow it beyond there, rather than simply having federal dollars or state dollars trying to do a subsidy to the affordability. We've tried that. There's not enough dollars available to do something like that. And there is frustration with that and accountability with that. By bringing employers in and having a seat at the table, there's going to be far more accountability to how the child pay or provide that care. So that's what we wanted to come up with, something different, something more creative. So I think there's interest in this. There's interest to see how many families, how many workers, how many employers start signing up for this. And that's what we want to do today, is promote this, get the word out so that employers know about this and get interested so they can provide this benefit to their employees as well.
As the program grows and you get many more employers, many more families especially, and more kids, and you've got significantly more to serve, is there a thinking that the legislature is willing to raise that allocation each year as the program grows, or is this an eventuality that it needs to be taken over by another party?
From my perspective, we have tried to craft this in a way that eventually we can use those federal dollars that we receive and use it potentially for this program. If we have a model that works here in the state of Michigan, there's a potential that we could ask for a word from the federal government saying, hey, we've done it. Here's a way that actually saves costs, because you bring the employer and the personal into this equation. This actually saves dollars and provides for hopefully better care, more affordable care. So that's why we were kind of in that pilot phase to say, hey, here's a potential new model that would actually save the amount of dollars that we use because you have another source of income, which is that employer side.
What happens if the federal government doesn't do that?
Again, we have to prove the model. If we prove the model, there's the option to potentially ask the federal government for a waiver. You've seen different waivers in state government, whether it's Medicaid or some more of the DHHS stuff. But, they are looking for different creative models that would create more affordability and less dollars coming in.
Thank you.
All right. Thank you, everyone. We are out of time for our Q&A. I have put my contact information for the media members. If there's anything you would like to ask afterwards, feel free to email me. And we thank you all for joining us today.